Ever had trouble sleeping at night? You're not alone. Insomnia, a sleep disorder that affects countless individuals worldwide, could be the culprit. It's a common issue that many of us grapple with, often silently in the dark hours of the night. Insomnia doesn't discriminate. It can impact anyone regardless of age or lifestyle, and its effects can be far-reaching, seeping into our daily lives. But what exactly is insomnia? Simply put, it's a sleep disorder that can make it challenging to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. It's like an unwelcome guest that overstays its welcome, leaving you feeling exhausted and frustrated. The nights seem endless and the days become a struggle to stay alert and focused. So if you find yourself tossing and turning at night, you might be dealing with insomnia. How can you tell if you're suffering from insomnia? This question is one that plagues many individuals. The symptoms of insomnia can be quite varied, but there are a few common signs that might suggest you're dealing with this sleep disorder. One of the most obvious symptoms is difficulty falling asleep. You might find yourself tossing and turning, unable to switch off your mind and drift into a peaceful slumber. Another symptom is frequent awakenings throughout the night. These disruptions can make it hard to get a full night's rest, leaving you feeling tired and groggy in the morning. Waking up too early is another sign. Despite your best efforts, you might find yourself wide awake at the crack of dawn, unable to fall back asleep. During the day, you might experience excessive sleepiness, difficulty concentrating, and irritability. These are all signs that your sleep quality is compromised. If these symptoms sound familiar, it's possible that you're battling with insomnia. But what causes insomnia? Well, it's not a straightforward answer. Insomnia can be triggered by a variety of factors. Let's start with stress and anxiety. Worries about work, school, health, finances, or family can keep your mind active at night, making it difficult to sleep. Similarly, traumatic events or the everyday hustle of life can lead to anxiety, another common cause of insomnia. Depression is another culprit. Changes in mood and hormone levels can disrupt your sleep, leading to insomnia. Certain medications, especially those for heart disease, high blood pressure, and asthma, can interfere with sleep. And let's not forget about caffeine. That late-night cup of coffee or tea might be the reason you're staring at the ceiling at 3 in the morning. Poor sleep habits such as an irregular sleep schedule or an uncomfortable sleep environment can also cause insomnia. Lastly, certain health conditions like chronic pain, breathing difficulties, and neurological conditions can disrupt your sleep, leading to insomnia. Understanding the cause of your insomnia is the first step towards overcoming it. Insomnia isn't a one-size-fits-all disorder. Imagine a wardrobe of sleep disorders, each with its own unique cut and style. Let's explore these 5 main types. First, acute insomnia, a brief bout of sleeplessness often sparked by life's stresses. It's like a short-lived storm in the night, usually resolving without treatment. Then there's chronic insomnia. This long-term pattern of difficulty sleeping lasts for at least 3 nights a week for 3 months or more. It's the stubborn, lingering fog that makes mornings feel endless. Comorbid insomnia is when sleep issues are intertwined with other health conditions, mental or physical. It's like a knot that needs careful untangling. Onset insomnia refers to difficulty falling asleep at the beginning of the night. It's the frustrating delay before the curtain of sleep falls. Finally, maintenance insomnia, the inability to stay asleep, disrupting the act in mid-scene. Just as there are many types of insomnia, there are many ways to treat it. Don't lose hope. Insomnia can be overcome. One of the most effective strategies is improving sleep hygiene. This includes establishing a regular sleep schedule, creating a restful environment, and avoiding stimulants like caffeine and electronics close to bedtime. Another powerful tool is cognitive behavioral therapy. This approach helps you identify and change thoughts and behaviors that lead to sleep problems. It can help you control or eliminate negative thoughts and worries that keep you awake. Medication can also be an option for some, but it should be used under the guidance of a healthcare professional. It's essential to remember that everyone's experience with insomnia is unique, so what works for one person may not work for another. If insomnia is affecting your quality of life, don't hesitate to seek professional help. You're not alone in this fight, and there are proven strategies and treatments that can help. Remember, a good night's sleep isn't a luxury, it's a necessity. Subscribe and support Democratizing Neuroscience to learn more about the brain and its mysteries.